Maintaining privacy and confidentiality is crucial to the patient-healthcare professional relationship. Three Mountains Regional Hospital Code of Ethics was developed to promote integrity, accountability, and trustworthiness between patients and our healthcare professionals. The hospital's visions and values are trust, respect, and dignity, and reflect our responsibility to achieve healthcare excellence for our community. A patient intake packet was created for patients to understand their rights and responsibilities, the hospital's goals and standards of care, and pledge to follow all principles and maintain the confidentiality and security of our patients. We'll first discuss Code of Ethics. Code of Ethics are ethical behavior. They're moral principles, beliefs, and values that guide healthcare professionals. The sense of knowing right from wrong. Matters of medical compliance, like policy and procedures. The following slides will introduce some of the ethical dilemmas healthcare workers face and are held accountable to. Ethics are not optional in medicine. They are essential. Ethical codes can give shape and structure to the moral environment. The relationship between a patient and a physician should be based on trust. Physicians' ethical responsibility is to place patients' welfare above the physician's own self-interest. They are to use sound judgment on patients' behalf, and physicians are to act as patient advocates. A physician's obligation is to respect the rights of their patients, colleagues, and other healthcare professionals. They should respect the rights of an individual to make their own medical decisions, and strict avoidance of discrimination, things of religion, race, and sexual orientation. A physician shall be dedicated to providing competent medical care with compassion and respect for human dignity. They shall uphold the standards of professionalism. They should be honest, and they should report physicians deficient in character or competence or those who engage in fraud or deception. Medical records must be available to document all services and meet standards. Records must be accurate and complete. They must conform to applicable legal, contractual, and government requirements. Claims must be submitted only for services rendered and in a timely manner. Ensuring accuracy of claims submitted for services provided. Billing, claims, and cost reports need to be consistent with government rules and regulations. Otherwise, penalties, which include fines and/or imprisonment, may occur. Political activities. Contributing money, time, or services to a political organization or campaign. Now, doctors can do this as an individual, but not as a representative of an organization. Engaging in activity that either support or oppose a political candidate or party, and being a candidate in an election. A conflict of interest occurs when the primary goal of a patient comes into conflict with any other secondary goal. Personal gain that increases revenue to an organization from selling products or services. Personal gain that influences the way in which an individual carries out the organization's responsibilities, and personal gain that damages the reputation of an organization, staff, or patient. Commercial promotions or medical products and/or services. This may cause bias unrelated to the product merit. Media ethics impacts on healthcare. Low communication barriers in social media. Limited privacy and security issues lead to problems from an ethical perspective. Guidelines for patient-doctor communications, email communication, and exchange of information through websites are a concern. Preserving privacy and confidentiality of online users. Unauthorized access to computers and informed consents are privacy risks. Open, honest communication to maintain the trust of patients, customers, shareholders, and stakeholders. It must follow the rules of patient privacy. Physicians must protect patient privacy. Patient privacy includes personal space, personal data, personal choices, and include cultural and religious affiliations and personal relationship with family members. Minimize intrusion of patient privacy when it must be balanced against other factors, and inform the patient when there has been an infringement of privacy, when the patient would otherwise not be aware. Patients need to disclose personal information for treatment, which may be embarrassing or harmful if known by others. Physicians must keep all information confidential. This is the Code of Professional Ethics. End-of-life advanced care planning that allows a patient to have peace of mind that their physician understands and respects the patient's end-of-life preferences, principles, and decision-making to give or withdraw medical treatments that would allow death to occur naturally, and being truthful regarding a patient's prognosis. Crucial issues in genetic and reproductive technologies are methods of fertility, such as cloning, harvesting embryos, and in vitro fertilization. Abortion. Many believe that human life begins at conception. All embryos should be treated with the utmost of care. Genetic and reproductive medicine and genetic testing can provide information to support decisions regarding personal health care options and reproductive choices, which may cause ethical dilemmas for some with strong religious beliefs. Organs for transplantation and donation. Living organ donation presents a unique ethical dilemma. Physicians must risk the life of a healthy person to save or improve the life of another person. The United Network for Organ Sharing is responsible for allocating organs for transplant. These decisions are not made by healthcare workers. Protecting the rights of both the organ donor and organ recipient is crucial. In conclusion, healthcare professionals deal with ethical dilemmas every day. It is important to understand that these disagreements occur when a medical decision can have both a positive and negative result. Physicians and healthcare workers may follow ethical standards, but sometimes there is no correct answer, and they need to be aware of these risks. Following policies and procedures helps ensure the care is provided properly. This can become complicated due to complex patient care, operational policies and procedures, and legal challenges. When faced with a potential ethical dilemma, ask yourself the following questions before acting. Is it right? Is it fair? Will someone get hurt? If my actions were reported in the newspaper, would I be embarrassed? Would I tell someone else to do the same thing? Ethical standards often require the entire care team to work together to find answers when treating patients. Obtaining legal advice is sometimes necessary to ensure the best quality of care is given.